Hi everybody, my name is Elise. I'm the social media manager at Faces Plus, and I'm here with Dr. Cohen, our surgeon, and Dr. Widgerow, Alastin Skincare surgeon, and they're here to talk about how to give your skin a complete cleanse pre and post procedure and what procedures work the best with these techniques. So without further ado, say hello.
Hi, I'm Steve Cohen. I'm the plastic surgeon at Faces Plus, and over the last 14 years, I've really been working with many other researchers and scientists and clinicians in the field on trying to figure out not just how to treat aging when somebody walks in the office, but how to intelligently manage aging over time. Because if you really think about aging, we grow for 22 years and unfortunately our tissues decay after that based on genetics and the environment. More and more we're looking at dynamic ways of maintaining tissue health. I think one of the things that we've really been able to help pioneer are using new strategies where we're harvesting tissues from our own bodies to replace and regenerate these deteriorating tissues in our bodies as they deteriorate rather than after the fact. One of the reasons I've embraced the Alastin technology that Dr. Widgerow will talk about is the fact that it's intelligently designed to address some of the material outside of the cell, the extracellular matrix, and to function almost like, somebody who comes by and cleans up your yard or cleans up the waste material that, we put into our trash cans. And I think that as we begin to strategize, how do we take care of our cell better? How do we take care of our tissue better? How do we take care of the matrix around our cells better? All of these things play a role, and I'm really excited to talk about some of these concepts. I wanted to have Dr. Widgerow talk about how we're clearing out the extracellular matrix prior to doing our laser procedures and prior to doing our surgical procedures to facilitate recovery, to improve these treatments, and to establish better long-term tissue and cellular health.
So thank you, Steve. Essentially, I'm Helen Wood, plastic surgeon by profession. I'm a professor of plastic surgery at the University of California, Irvine. And there I spend most of my time as director of tissue engineering. But on the other side of my life is really a chief medical officer for Alastin, where we develop products and I work with them on the R&D, and we develop new products really relating to the concept that Dr. Cohen was talking about. And it's really a pleasure to partner with Dr. Cohen on these because he keeps on the cutting edge of new technologies. And really what we plan to do with Alastin is to really prep the canvas before you do the procedure. And what I mean by that is really prepare the skin from all the exposure that's had over many years to a whole lot of elements, including and especially the sun. And the sun really damages the elements of the extracellular matrix that Dr. Cohen was talking about. And what do we really mean by that? We mean that the sun comes in and its rays really damage the collagen, which is the structural framework of the skin, and the elastin, which gives the skin tone. And that fragments it and breaks it down into little pieces. And there's a conversation that's going on that I can show you in a picture that really takes place all the time between the cells. So if we look at the surface of the skin here, are you able to see that, Elise? Mm-hmm. So if we look at the surface of the skin here, that's the top of the epidermis, but really the extracellular matrix that Dr. Cohen and myself are talking about is the factory that goes on here and the conversation that goes on between the cells, which are called the fibroblasts, and they produce these collagen fibers and the elastin that creates the structural framework. And that's where regeneration or new skin is really formed. This is the factory here. And we want to keep this as in the best shape possible. But what happens is all these years of the sun exposure and other exposure, these collagen fibers become fragmented. And the conversation between that cell and that fiber becomes interrupted. So that when you do your procedure, you don't get optimal healing. really what we plan on doing is trying to improve that whole situation. So that if we look at that under a microscope, we can see in this baseline slide here, what we've done is nothing has been done yet. That's on the face of a patient that we've then used the elastin for 3 weeks on the face, and then we've shown that even after 3 weeks, if you look at the pink fibers that are just under the epidermal layer here, you'll find that they've been stimulated and they've been increased to a large degree. I was talking about the elastin. You can get that kind of elastin stimulation, and we're talking about just with topical application. So that's really what's happening at a microscopic level and at a level that is related to the extracellular matrix, which is this factory that's producing it. We can get optimized skin treatment before Dr. Cohen starts his procedure, so that when he does do his procedure, basically the healing will be facilitated and easier. And we can talk a little bit about lasers and laser procedures a little later, but that's really the concept that we like to get at.
And then with injectable tissue replacement, how does that factor in to already having optimal collagen and elastin production from the product? How does that help the results?
Well, you know, it facilitates the results with a procedure in ways that Alan just described, where, you know, you're prepping the canvas, if you will, and you're speeding up repair. But if you take a little dial back and we look at the overall concept of aging, and I just want to show, maybe I could show a picture or two on that. If we look, for instance, at our own age, and as we progress, we really are trophic for 22 years, and by 22 years, skeletally, our height, our organ systems, everything is fully grown. And from that point on, we decay. Now, if you take decay and you think about it in terms of facial tissue, I almost think that the strategies that Alastin is bringing into the clinical arena around procedures will even be more important in the younger age groups to begin to take care of these kinds of things as they begin to develop. And so now, when I start to think about the major things that patients come in to see me about, which are sun damage or photo damage, volume loss, and laxity, somewhere between, say, age 30 and 50, depending on their ethnic background. But this happens to everybody. I don't care if they're blue, black, green, or white. Everybody, no matter what their ethnic background is, eventually will have these kinds of changes. And if we start to treat these or think about them early on, like, for instance, let's take volume right now. Right now, when we think about volume, we treat it with the filler. That's great, but that has zero impact on the curve of decay. If we start to look at things more intelligently, like the Alastin product and other kinds of products, we're going to apply these early because we want to facilitate what the body is trying to do, which is to clean out the waste. And if we are reducing our ability to do that because more and more waste is accumulating as we get older, as we have more sun damage, as we begin to decay, if you're not taking care of your house, what's going to happen to it? If you don't clean up your yard, somebody drives by and goes, look at that ugly yard. If you start to use products like Alastin early, and you start to think about biofilling maybe with your own materials early, perhaps some of these things are not going to even occur to the same extent that they occur. So I'm very much into using products like Alastin as dynamic health maintenance or dynamic tissue maintenance concepts.
I have a question. So just regular filler that's not from your own tissue, it has no effect on your collagen, elastin production. Does it have like any effect at all, like any negative effects from not using your own tissue?
And it has some mild biostimulatory effects. You know, when you stretch tissue, you have some effects in the region. There's some fillers that are more biostimulatory, like Sculptra actually stimulates the dermis to thicken. And even after the Sculptra is gone, there is a transient period of thickening that remains behind, but gradually disappears. So mostly fillers are thought of as being used for appearance, but what we're treating that appearance change for some people is I want nicer lips. That's one thing. But if somebody is coming in with volume loss from facial aging, we need to also be thinking not just about appearance, but we have to be thinking about function and what's really happening. Because in this case, truly form follows function. So if we take better care of the tissue health, that deterioration is going to slow, and then you begin to use fillers for what they're really designed for, which is, to create an enhancement or an appearance change or a real pop, but not to take good care of our tissue. And what we're talking about with newer products and some of the things that are coming on board, such as the Alastin designs and other kinds of things like this, are ways of really maintaining our tissue health. And you can extend this to all parts of the body. And this is the way medicine is moving right now. It's really dynamic health maintenance. It's not just taking care of yourself with your diet and exercise and limiting the sun, but it's starting to really design, cosmeceuticals and other kinds of pharmaceuticals around this idea of how do we prevent or slow aging and decay.
It sounds like it's more sustainability
Totally.
and like you said, it's a dynamic health maintenance. So that is like inside when you're eating something healthy, your body is going to function better. So when you're putting your own tissues into your skin is going to look and function better as well.
And you're going to regenerate,
elastin.
right? And you're going to regenerate tissue and regenerate blood supply and add that volume back in. But again, it's your volume, your tissue. It's a little bit like you change the carpet and you expect the carpet will get worn again. So that's why I say it has to be looked at more dynamically, not one thing versus another, but this is what's happening over time in a whole big orchestra of events.
It's really cool.
And Steve he's mentioned the magic word, and that's regeneration. And really what we're trying to do here is create regeneration, but also maintain the ability to regenerate. So what we do with the Alastin is to really try and synergize and add to what Steve is doing with his surgery, to what the devices can do with their lasers and with their resurfacing. Because after all, what we want to try and do is get the outcomes where the patient is looking better, but also having gone through that procedure where they actually take it better, where they feel better with it, and where there are less symptoms. So if I just translate that just into practical terms, if you have a look, Annalisa, can you see that?
Yes.
Now, right, so if we look, we did a comparison here between the standard of care, which would be at the bottom, versus the Alastin at the top. And this is what patients go through with resurfacing. If you look at the first one at day one, this is quite aggressive resurfacing of the face where we go down to quite a deep layer of the skin. And you expect that to regenerate over a couple of days. And what we found, that if we went right down to 7 days, we found that the patient is actually healed very nicely. But if you go back a step and you look at them at day 3 and 4, that's where the tipping point is. So if you look at the patient on the top versus the patient at the bottom, not only are you getting a symptomatic relief, but you're getting faster healing taking place. So that patient can get out there and go and get out into social terms much earlier than the other person, which makes a big difference. Also, with many of these procedures, we're now repeating them many times. So you want them to be able to go through a procedure without having had this as an unpleasant experience. And really what we're trying to do is really incorporate this into a process so that you prepare the skin, we prep the canvas, we get ready for regeneration so that the extracellular matrix is in its best form, and we also make the process smoother and easier and the healing outcomes improved. And that's really where I find that the synergy with working with people like Steve, it really works out that we can combine all our talents and what we're doing in the new science to produce better outcomes at the end.
It's almost kind of like insurance for your procedure, like your surgery.
Exactly. It's almost like taking a long trip and taking your car for a service before you go on that trip. You want to know the brakes are functioning, everything's functioning well. What we're doing here is before you go onto the surgical trip, we really want to know that the skin is in the best kind of position that it can be for regenerating and for healing.
But it almost seems, Alan, like in some ways, you're really working more and more with the body's own limited abilities to clean out the extracellular matrix, to regenerate tissue, and now taking advantage of what you know with Alastin to facilitate that kind of repair.
Absolutely.
It's kind of like giving the skin a kidney so it can, pee out the bad stuff.
And one of the principles that we sort of adapted after many years of wound healing was really what we're doing here is not creating miracles. We're facilitating the body's capacity to heal.
Exactly.
And it has this inherent capacity that is amazing
Right.
if you just create the right atmosphere. Yeah. And that's really what we're doing.
Yeah, no, I think that's a great strategy. And to me, this is the way medicine, not just in our area, but I think this is a reflection of wear and tear. And, this is the way we're going to approach, I think, many different organ systems. Right. I think it's very, very exciting. And I think, as I say, as I've come to learn more about this product, and I'm not here to promote it, but it starts to really play into this whole field in a really nice way and very unique way.
Thank you, and I believe there's great synergy between us in terms of our thinking and the way that we approach it. So it's been a pleasure.
Thank you. Well, that's great.
Well, I want to thank you guys for being here today and sharing all your knowledge. And we'll see you next time.